karaoke day. And "30 seconds before I begin. Thanks everybody for being here today. Very important day, and see all of you assembled. It's very much appreciated. Thank you. All right, Danielle, I'll begin. Good morning, everyone. I want to thank each and everyone here today to being part of this press conference. Our main goal today is to bring awareness of the coronavirus and what preparations our local health officials are undertaking. With that being said, I'd like to start the conference off introducing Earl Stoner, Director of the Washington County Health Department.
Thank you, Commissioner. Just wanted to provide some brief comments today regarding the situation that not just in Washington County, Maryland, but globally in the world is seeing. The health department, as the sort of leader in this, is obviously monitoring all aspects of the situation. We're taking steps to keep the community safe, keep the community healthy. The threat to Washington County at this time is low and has remained low throughout. Public health efforts continue to focus on containing the spread of the virus, but we must prepare for the eventual spread within communities, and I think that's a really important point. Containment efforts are ongoing, but there have been some communities that are seeing highly suspicious transmission, which would indicate potential spread, not here in Washington County or Maryland, but in other places around the globe and within the U.S. We will continue to provide information as it becomes available, and we encourage everyone to stay informed with credible, accurate, factual-based information. The situation in Maryland is there are 5 confirmed cases. All have been travel associated linked. There are no confirmed cases in Washington County. Our Washington County's established network of health and communications, emergency response professionals are working in a coordinated manner, a unified manner to keep communications open and to support planning and fluid operations. The Washington County Health Department specifically is coordinating with state and federal and local partners to lead the response efforts, all with the goal to minimize the risk to our community. Some examples of what we're doing are frequent, and when I say frequent, I mean frequent, briefings and coordination calls held with state and federal partners, namely the CDC and the Maryland Department of Health. We have established a unified coronavirus preparedness task force of critical state and local partners specific to Washington County. We're meeting weekly with the goal of coordinating information to the community, identifying and addressing any gaps that may exist, establishing plans to ensure first responders and healthcare, and specifically Meritus staff, ensuring their health and safety to avoid any sort of response or care shortages that we could face in the future, and to address any resource needs that we may have. Health department staff are continuing to work closely with healthcare providers to ensure clinical and public health guidance is readily available, and if need be, and again, I say if need be because we haven't been in this situation yet, if need be, according to CDC guidance, to coordinate testing of any individual with CDC and the Maryland Department of Health. Probably one of the most important parts now is what you can do to prepare. Though we remain at low risk here, now is not the time to panic, but now is the time to prepare and to plan. And you can take very basic steps that we all should be taking during flu seasons anyway, to keep yourself and your loved ones healthy. The first and most critical is stay informed. I mentioned it before. Stay informed with credible, accurate information. CDC.gov, the Maryland State Health Department has a website, health.maryland.gov, and the Washington County Health Department has a site, washcohealth.org. We all in our community, not just responders, not just healthcare professionals. We all have a collective responsibility to practice everyday actions to promote good health and prevent the spread of any sort of respiratory virus, and obviously in this case, COVID-19. I can't stress this enough. Wash your hands frequently, wash your hands thoroughly, 20 seconds. If you can't wash your hands at the moment, use hand sanitizer until soap and water is available. Cover your mouth and nose when you're coughing and sneezing. Avoid close contact with individuals who are sick or you suspect to be sick. And if you are sick, stay home. If your kids are sick, don't send them to school. Avoid touching your eyes and avoid touching your nose and mouth. Another critical point would be building a preparedness kit for your home in the case that you are sick and would need to stay home. Pain relievers, fever reducers, decongestants, cough drops, alcohol-based sanitizers, thermometers to monitor your temperature, facial tissues and paper products, non-perishable food, extended supply of prescription medications, and if you have little ones, diapers, and pet supplies if needed. But again, the central message here is now is the time to prepare, not panic. Now is the time to plan, not panic. Stay informed and use basic everyday common sense when it comes to preventing the transmission of any sort of virus, which includes coronavirus or COVID-19. Thank you.
Good morning. I'm Dr. Ali. I'm the infectious disease physician at Meritus Medical Center. As an infectious disease physician, I have seen so many pandemics. I think the last one was H1N1, probably. That was in 2009. The mortality that we are seeing with this COVID-19 is actually not in any excess than the H1N1. So it is usually these viral infections are seasonal infections. So, and most common symptoms are cough, runny nose, and sore throat. And majority of the infections are mild that can be managed at the home itself. There are 3% of cases worldwide who are getting excessively ill, and particularly those who have health issues, older people, more than 65 with dialysis, diabetes, heart disease, and lung problems. So, but having said that, our problem is that we have done testings on only the patients who have traveled to those suspicious countries and those who are quite ill. So the death rate or the mortality that we are seeing might be falsely high, because there are a bunch of people in the community who are mild and asymptomatic. And if you start testing all of those patients also, then the denominator gets bigger and the mortality rate is much lower. So all in all, I would like to say that there's no need for panic. Treat this as just any other influenza epidemic or pandemic. But be cautious, don't panic. Like the guidelines from the Department of Health, wash your hands frequently, cover your coughs and sneezes. And now at the level of the Meritus Hospital, I also chair the Infection Control Committee there. And we always have a policy for preparedness in case of pandemics like influenza or any of these novel viruses. So we take basic precautions. Starting from the first responders, that includes the emergency room physicians, the EMS staff, to the ICU physicians, and then to the general medical community, the healthcare staff. Starting from the first responders, we have trained everybody to ask the proper questions for people coming to the urgent cares, doctor's offices, and the emergency room. And we also advise people to call ahead of time before visiting the emergency room so we can prepare for your arrival. The idea here is not to expose too many people if you are ill. So we have a separate isolation room for patients who are suspected to have such illnesses. In some cases, you might be asked to wait outside the emergency room while we prepare for your room. So we have a very dedicated protocol and personnel trained for proper lab testing on these suspected cases, proper management, and placing them in the proper isolation rooms. For patients who are in the outpatient setting, we also have a hotline created. So there will be 1 or 2 nurses actually taking your calls and screen your questions and the symptoms, and depending upon that, we'll guide you through. At this time, the testing for COVID-19 is also available through the LabCorp, as well as I think the Quest will also start testing soon. So the test will be widely available. But please call ahead of time before coming to the emergency room or urgent care centers or the doctor's offices. Katie, do you like to add anything for me?
So a couple things. My name is Katie Selesky. I'm the emergency management specialist at Meritus Medical Center. Some of the things I just wanted to drive home for Dr. Ali saying, the hotline that we have, you can call that. The number is 301-790-9170. Again, that number is 301-790-9170. Additionally, we've created an email address that can be used for our staff at Meritus and the community. That email is COVID-19@meritushealth.com. Again, that's COVID-19-19@meritushealth.com. You can email that address and you will receive a response within 48 hours. Typically, when you email that, you'll receive a canned message, and then within 48 hours, you will receive an actual message to your question. Additionally, some of the things that I did want to bring up for those in the room, at Meritus, we prepare, as Dr. Ali said, for this annually, but we want to make sure that we have the proper precautions for our staff at Meritus, so you may see some new changes. We are making sure that we have the appropriate personal protective equipment supply for those of us who actually need masks. So one of the things you may see if you're entering and you're a visitor, you may receive a bandana instead of a mask. Again, that's to make sure that our staff actually has the appropriate protective equipment that they need. We do have some visitor restrictions. Of course, we have the typical flu restrictions. Also, if you've traveled overseas or to a country that is affected by COVID-19, we will ask that you not visit at Meritus. Of course, for children under 19, we will start temperature screenings. And if you have a temperature, we will ask, and that you've been to one of the affected countries, we will ask that you no longer are able to visit at Meritus. We are also preparing a COVID-19 screening drive-through for patients. Where we will be able to have you drive through in your vehicle and possibly have a COVID-19 test. Thank you very much.
Thank you.
Good morning. David Hayes, Director of Emergency Services for Washington County. We've been working for several weeks now with our partner agencies, Washington County Volunteer Fire and Rescue Association, Hagerstown Fire Department, the local EMS community, and the volunteer fire and EMS units outside of the city of Hagerstown, in anticipation that we would have to come to a point and figure out how we would deal with potential staff exposures and continuity of operations. So most of our stuff has been centered around ensuring that we have a proper or the appropriate personal protective equipment that is known to help us make sure that we can continue to provide care to you. Some of the measures that we've taken to date, we do have a current inventory of what is the N95 mask throughout the fire and emergency community. And at this point, in response to that, to try to standardize the type and manufacture of the mask and allow us to make sure that we maintain compliant with the OSHA regulation for fit testing for the providers, we have ordered 2,000 N95 masks. We've received delivery of 650 of those, and we're waiting an additional delivery. We've also placed the order for the qualitative fit test, and all of that is designed to make sure that our staff have the appropriate personal protective equipment to continue to meet your needs. We're looking to launch an aggressive fit test schedule and have 100% compliance from our providers relative to the new mask in 7 to 10 days. And then we are also conducting continuity of service planning both internal to the Division of Emergency Services and then externally amongst the volunteer fire and rescue community, and our partners at the Hagerstown Fire Department, I believe, are doing the same. The 911 center itself, we've taken internal measures to try to limit exposure of the staff to any type of infectious virus, certainly COVID-19. We currently have hand sanitization stations at each of the 12 workstations. We're working, we have a backup center located here at 100 West Washington Street. We're going to isolate that, make sure that that maintains a sterile environment so that if we have an exposure in the primary center, we can move our staff down to 100 West Washington Street and not continue any kind of infectious exposure to them through that. The other big thing that we've done relative to county government is work on reviewing our continuity of operations plan. We've consulted with the county administrator and county commissioners and have developed a continuity of operations leadership team, and that is going to consist of the county administrator, the county attorney, the director of emergency services, the county's emergency manager, the chief financial officer, the director of information services, IT, the director of public relations, the director of human resources, and the director of purchasing. And their purpose will be to establish and revise as needed the current continuity of operations plan for Washington County, and then ensure government services are maintained in the event of any need for isolation or quarantine internal to county government. And then we're going to be providing internal administrative support to the county attorney and the county commissioners as we move forward. So that's really the activities that we've got going on in the emergency services. We're prepared to meet the challenge, and as you've heard before, again, now is the time to plan, not panic, and just maintain good infection control measures, which is the basic of all basics. Wash your hands, don't touch your face if you don't need to, and try to limit some type of personal contact where it's not necessary. And then from that point, I'll turn it over to Sheriff Mullendorf.
Good morning. Sheriff Doug Mullendorf, Washington County. So just like our fire and EMS partners, we are participating in the coronavirus task force. We are preparing for the event that we should have some kind of an outbreak in Washington County. Hopefully that will never occur, but we have to be prepared for that. So you may see us do different things. For example, starting today at our courthouses, they will be wearing gloves to check baggage and do all the things that they would normally do. Don't be afraid of things that we're doing. If you see someone wearing a mask, that's for our protection because we have a limited number of first responders, and so we want to protect them as well as the community. And the only way we can do that is to safeguard ourselves as well. We also have a detention center. And so right now, actually, I have flu in one of the housing units. And so if you see us or hear of us doing a lockdown of the detention center, it may not be because of coronavirus. It could be because we have flu in the jail. So don't panic. Family members and friends and loved ones of the inmates in the jail. We're doing that for their protection as well as yours. So. We continue to prepare, and we ask the public just not to panic, to allow us to do our job so that we can help you. Thank you. I'm going to introduce Dr. Boyd Michael, Superintendent of Washington County Public Schools.
Good morning. Washington County Public Schools, I want to assure you, is also doing our part to help prevent the spread of the coronavirus. In an effort to prevent the spread, I think you've already heard from a number of folks, the most important thing we can do is wash our hands. And we are encouraging that action alone to help us with, to stop the spread of just a normal flu, let alone this flu. So we've placed a number of signs throughout our school system in all of our bathrooms and our elementary classrooms. We have staff that's encouraging children to wash hands with their youngest children. We're showing them how to wash their hands. We're also helping to promote healthy habits with when you're coughing and sneezing, appropriate etiquette to help prevent the spread of flu or flu symptoms or symptoms or cold symptoms as well. We stepped up a lot of our sanitation protocols throughout the county. I want to thank our custodial staff for the tremendous effort they're doing in our 48 buildings across the county. Also our bus drivers, other people We're working to continuously clean our buses, our classrooms, our offices, kitchens, cafeterias, athletic equipment, even musical instruments and the like, to help keep those items clean. So our custodial staff is working beyond the normal school day. We have them working second shift after the students leave to continue with our cleaning efforts, stepping those up, and we'll continue that as long as necessary. To parents, I'd want to say, if your child is sick, particularly if they have a fever, we want you to keep them home. We want to help them get well as soon as possible. That would be a tremendous thing in helping us prevent the spread, again, of just even the normal flu. I know there's been a number of questions about field trips and athletic events and performances. As of right now, all those things were continuing to occur. We don't have any plans to cancel any of those, but obviously we're monitoring them day by day. We'll take our guidance and direction from the experts of the health department, and we're monitoring travel advisories across the county, across the state, even outside of the United States for some trips that we have coming up. So we will continue to monitor our attendance. We're in constant communication with the health department. We keep them updated on anything that we see, if we see any spikes in, again, flu or flu-like symptoms across the county. We greatly appreciate the partnership we have with Meritus, with the health department, the county government, all our various partners here to help keep our community safe. So again, just thank all of those folks. To parents, another thing I would probably say, if you haven't received communication from us in the last 2 weeks, we've sent out 2 mass communications. Contact your local school. Make sure that we have your current updated information so we can contact you either by email, text, and or by phone call. Thank you.
Good morning. Scott Nicewarner, City Administrator for the City of Hagerstown. I'll address the City of Hagerstown's response to any possible events resulting from the COVID-19 virus. First, a task force has been created within the city to address the issue and act as a conduit between the county health department and our staff. Second, staff have received an email regarding the facts of the COVID-19 virus and steps they can take in preventing the acquiring and or spreading of this or any virus. Third, a draft pandemic emergency plan has been created and distributed to city management and will be reviewed in depth more this week. This document will address maintaining critical and high priority service levels should a reduction in staff occur, continuing education of staff to reduce virus transmission, minimize illness among employees, maintain cooperation efforts between Washington County government and Washington County Department of Health. City departments are also reviewing their operations contingency plans, and as you heard from our public safety professionals, they are certainly prepared to address this event. The main message at this point to all city residents is to do what you've heard already today by our previous experts. That would be to wash your hands, use a tissue or your arm to cover a sneeze, limit shaking hands with others, and those are just to name a very few of those. And also, whenever possible, maintain a 6-foot distance between you and others. As a city, we'd like to thank the Washington County Health Department and Washington County government for their proactive planning and leadership for any possible event that may occur in our area. Thank you.
Good morning. I'm Nan Mann. I represent Senator Van Hollen. My colleague Robin Summerfield is also here representing Senator Cardin. Both the senators have spoken with Governor Hogan, along with the rest of Maryland congressional delegation, stand ready to bolster the state response in any way they can. Last week, they were proud to support the $8.3 billion funding package that passed the Senate. This bill will help ensure that Maryland has the resources necessary to immediately and more effectively respond to the coronavirus. They are pleased that Congress was able to come together on a bipartisan basis to provide this significant investment to immediately boost our efforts to address the virus. This comprehensive package will provide our state and local governments with direct financial support to address this public health crisis. We must continue to work together at all levels of government to coordinate our response. This bill also contains critical resource resources for the research, development, and approval of the potential vaccine, treatments, and diagnostics, work that is being done here in Maryland at NIH and at the FDA. Additionally, the legislation provides funding to support preparedness at our hospitals and health centers to bolster their capacity to handle the coronavirus on the front line. The bill also includes critical support for the small businesses that have been impacted by financial losses stemming from the outbreak. A couple weeks ago, they heard from Maryland business owners with concerns about this issue and worked to include this in their provision. As we continue to combat the coronavirus, they will keep fighting to ensure that Congress provides the tools necessary for an effective response. Thank you.
Good morning. My name is Kirk Downey. I'm interim county administrator and county attorney. Wanted to thank you all for being here this morning. It is appreciated that we get this information to the public. Want to reassure the public and our local citizenry that county government is taking the threat of COVID-19 proactively and is working with Community Health Coalition partners under the direction of the local health officer, Earl Stoner, to proactively prepare for the potential of a coronavirus outbreak here in Washington County. Again, we want to urge citizens to use common sense, to stay home if you are ill, again, to echo what you have already heard this morning, to take proactive measures to keep yourself safe and to prevent the possibility of a corona outbreak here in this community. Again, wash your hands, use hand sanitizer, cover your coughs, and again, stay home if you're sick. The county has put together a continuity of operations task force to ensure that essential government services will continue to be provided to citizens in the event that there would be an outbreak here in the community. Again, we have prepared proactively to make preparations to assure the continued operations will continue. Thank you very much. Please, again, use common sense, and we appreciate your participation this morning. Thank you.